How is everyone doing today? Let me know in the chat. I hope everyone is having a great Gym Saturday. Once again, my name is Chandler Sheck Snyder. I am the head of community at Pharmacy Initiative Leaders. And once again, I'm so proud to partner with Innovamp Healthcare, an amazing organization stationed in Africa that has made this experience possible. It's been 2 to 3 years in the process of us trying to create this global exchange mentoring program for you by us. And we want to continue to impact you at every stage. So thank you so much for being here. I know that it's about 5 p.m. in Nigeria right now, so it's almost time to party later on. So I definitely want to be mindful of your time, and thank you so much for taking this time to develop yourselves. Like I said before, Innovamp is a Innovamp and Pills are so glad to have you here. And once again, Gym is a collaboration between these two organizations to impact you. So without further ado, I want to introduce our esteemed guest, who is not a guest to Pills, but maybe a guest to you, and someone that I believe will impact you today as well. We have Dr. Bryan Sackey, who is a psychopharmacologist at the San Antonio, South Texas VA. And also he's the founder of Pharmacy Initiative Leaders and currently the executive chairman on the Pills board. So Dr. Sackey is going to be able to talk to you about connecting with your mental health. So please be engaged, please ask questions, and please be a part of this discussion today, as it's really going to be influential and it's really going to help all of us. So without further ado, Dr. Sackey, take it away, and I'll let you share your screen.
Thank you very much, Chan, for that amazing introduction. And thank you all for being here. Like Chan mentioned, the fact that we're now taking this global and really interacting with our brothers and sisters across the sea is really awesome to be able to share ideas and thoughts, just emotions and mental emotions and all that stuff we're going to talk about later. But it's just awesome to be able to connect on that level too. I want to give a shout out to Innovamp for giving us this opportunity, this platform, and partnering with us, as we also are fortunate to have you guys to be able to be a part of us in this journey. I'll go ahead and get started. Let me go ahead and share my screen. Now, let's see here. I'm the worst at tech, so bear with me. There we go. Can everyone see my screen?
Yeah.
Yes, sir.
Okay. So as I mentioned, GEM, which stands for Global Exchange Mentor, and you guys have done this 3 times now, so you're the pros. You know exactly what's going on here. But I want to let everyone know that with this conversation, is going to be exactly that, a conversation. I want us to be able to all talk, express ideas. I'm going to be calling on you all a lot, and I might just pick random names if no one volunteers. But some questions are going to prompt you to perhaps speak. Some questions may prompt you to just type something in the chat, whatever you feel comfortable with. Nonetheless, I just want us to have a good time, enjoy, learn, and take away something that could benefit one another. Now, I don't have to go too much into what I do, my background and everything, because Chandler did an amazing job of getting that across. But I do want to just point out here that with this discussion, I want us all to really try to be able to connect with our mental health, regardless of where you are in that journey, whether you're in the psych field like myself, or not really sure what mental health all entails. This is an opportunity to kind of just embrace the information and at least just take a second to see, where's my mental health. I have nothing to disclose, no relevant material, financial interest whatsoever. All right, we're going to jump straight into it. What does mental health mean to you? Like I said, I want you all to be able to talk, discuss, and feel free to, I don't know if it's okay, Chandler, if they unmute and say what they feel, or if you want to type in chat, just let me know.
Yeah, everyone has the ability to unmute themselves, so that it sounds great to me.
Hi, this is Star.
Hey.
Hello. Welcome everyone. What does mental health mean to me? Mental health is health to me. I think being in healthcare, I have been forced to come to terms with always checking in with my mental health. I've been forced to check in with my mental health because, as we all know, um, being in healthcare is incredibly demanding. Um, it is really having to check in with yourself and be like, am I okay? Because here's the thing, if we're not okay, we can't be okay for the patients that we serve. So mental health for me is everything, because here's the thing, you can be great physically. I've been in great health physically, I've shown up to work, but I haven't been my best self. So mental health is showing up as your best self. Mental health is everything is going okay, because if you're okay mentally, you can take on other stuff. But in order for you to have great mental health, in order for you to have great health across the board, we really have to prioritize our mental health. And it's hard in healthcare, at least for me, I'll speak for myself, to prioritize my mental health, because it's just, physical health is really like prioritized. It's like, yeah, as long as you're physically healthy, you're fine. No, but I don't feel okay. And so for me, mental health is, it needs to be more of a priority, and it needs to be the thing that makes me check in with the other parts of my health. So if my
Oh,
mental health's okay, it makes me want to check in with other parts of myself.
I love it. I love it. See, and that's, I love the passion within your answer. I know me and Star, we've done a few presentations actually that's associated with mental health, and I can always see how much it means to her, and that's why this question is beautiful. It's very dynamic. It means this thing for this person, it means something else for another person. I would love to hear other people too. What does mental health mean? And if there's anything in the chat that I'm missing, challenges, feel free, let me know.
Yeah, so in the chat, what we have here is from Anuli Okoye Oyibo. She mentioned that mental health means checking into well-being, not just physically. Um, Carson Snag says taking care of yourself holistically. Um, Elizabeth mentions mental health is also about cognitive well-being. And of course, Chantel Houston mentions says staying present.
Hmm.
Yeah.
I love it. I love it. I love it. That's wonderful. Well, we're gonna have plenty more opportunities to talk more about just what does it mean to you. But I know that a lot of the discussion and comments, throwing out various words that we see when we talk about mental health, all right? Anxiety, stress, panic, felt depressed, felt shame. These are, you know, just understand it's a state of your mental health, right? So when we say these things, it just doesn't automatically distress. These are ways to describe certain extremes of your mental health. And overall, we have to identify, like Star actually mentioned, it's part of your essence. It should be your mental health, your physical health, all of that should be intertwined. So just checking the status of it. Now, as you all know, we always have to give out some gems every Saturday. I got a few for y'all, but we're gonna start with the first three, okay? So mental health. Mental health is a journey, not a destination. We'll talk more about that in a second, but just understand that it's not about getting to a certain point. A lot of it has to do with the process in it. Mental health is as much your external as it is your internal. So as much as you're working in your internal, that goes into the whole concept of people saying, oh, it just must be all in your head, right? We don't recognize that the things that are building internally are being expressed externally, whether we like it or not. And at the same time, things externally are playing such a huge role, a lot of times subconsciously in your internal. So understand that it's a parallel and one that must be focused on equally. And mental health healing is a dynamic process. And we'll go into detail into all of that, but understand that it's not just one way to solve problems. It's never just one path is the ultimate process. It's the ultimate way, and no other processes work. it takes several components of your overall well-being and different modalities to get to ultimately where you want to get to in your mental health. So those are the first 3 gems. Mental health is a journey, not a destination. Mental health is as much your external as it is your internal. Mental health healing is a dynamic process. So let's talk about mental health as being a process, right? What does that mean? So mental health is not a destination, but a process. It's about how you drive, not where you're going. Mental health is not a destination, but a process. It's about how you drive, not where you're going. Mental health is not a destination. It's a process. It's about how you drive, not where you're going. So I'll kind of take a second here. What does this mean to you? I want to hear from you guys. Or what are the visuals telling you? What is that phrase telling you? Think about the various drives and the environment, everything. What does that mean to you? I can pull up the chat if anyone's written anything there or processing it. And I'll start calling on people. Carson, I know you mentioned that you been delving into mental health. What do you think about it? There's no right or wrong answer at all here. It's just really just kind of the concept. What do you think about when you hear that phrase and or see these visuals?
Yeah, so actually it goes back to something that my parents started to tell me as far as like it's not about hmm I okay, they'd be disappointed because I can't remember. But something along the lines of, it's a marathon, not a sprint.
Mm,
And it's just, they always have a saying as far as something about action and reaction. And so
mhm,
there'll be speed bumps, right? So as this image here is literally showing me that this car is like airborne or something. So
yeah,
I'm imagining that as kind of a speed bump, and it's about how the car will land, right? There will be speed bumps and challenges, tribulations, whatever we want to call it, obstacles, but it's about how you recover. It's the reaction. Actions are kind of inevitable. They're going to happen. However you believe it, faith, destiny, whatever you believe, things are going to happen, but it's how you react. Um, so I think that's what this image is kind of reinforcing here. It's not about it's not a destination, it's just more so the process, how you react. And there's not an end goal. I guess there is an end goal kind of, but it's not, it's just fluid.
right, right. I love that. I love virtual class. I love that. No, that's awesome. A lot of what you said is exactly what these images were portraying. There's going to be some inevitables. There are going to be things in your way as you're driving. There's going to be some sort of perception that you can't drive. There's going to be moments where you can't drive. There's going to be moments where you can. What are things that we notice about each driving scenario? There's trees. There are sides of the road. There are objects. It's always going to be something there around that you can't control for. So understand that it's not about getting to a certain place and saying, I'm here now, I'm good. It's dynamic, it's fluid, it's the whole, it's your day to day. It's kind of like when someone says, I'm going on a diet, whereas really the most productive thing is to change your lifestyle habits and change the way you eat, just period, moving forward. I know that there's going to be some ebbs and flows, but the concept of it is not just to get there and say I got there, sustaining it and embracing that process. Good. I love the discussion. Okay. Well, sorry. Okay, but so probably thinking this is all in your head, right? Like this, all this stuff is just I always hear it, but it's probably just all in my head, right? Like, I mean, what are we talking about? Maybe you could think it away. Well, let's meet Mr. Olu Beckham. He's a superstar soccer player for the Ghana Black Stars. Shout out to the Black Stars. So Mr. Olu Beckham playing soccer one day at practice, he injures his leg. Actually, he breaks it, right? So devastating injury. And now, so what does this mean? How did this person heal? How do they get back to their great self? Well, there's going to take some emergency operation, perhaps something that they need to do right away to fix the damage. There's probably going to be some concept of administering things to help heal the process. You know, of course, a lot of rehab, because with therapy, just so many different components that you're having to go through essentially. And it's going to take a lot of your friends and family. It's going to take the people around you. It's going to take your own motivation, your own drive and desire to get better. You know, and eventually get back to your superstar self. I'm sure we'll be back. I'm ready to take the World Cup. Now let's meet Mrs. Chioma Kardashian. She's a 36-year-old female who just gave birth to her newborn. That's a stable job, supportive husband, sometimes, and a great circle of friends. Now, over the last few weeks, her friends noticed that she's not been the same since her child arrived. And she's isolating herself. She doesn't want to eat anything. She can't sleep. She's just constantly feeling down. Doesn't want to go out anymore. She can't concentrate on anything. She's dealing essentially with depression, right? So what is the difference between Olu and Chioma? You know, what happens when our minds are injured? Why can't we think about our minds in this way, in the sense that there could be environmental factors, it could be different things that may play a role in, you know, your mind taking an injury. And it's not just physical, emotional, or it's chemical. There's different components of injury that doesn't always automatically require some physical trauma. And so, you know, for example, Mr. Olu Beckham practicing hard, maybe then getting enough vitamins, you know, maybe he's under a lot of stress when it comes to he's put on his body. So those environmental factors led to the injury, but it took a lot of different processes and different stages in his healing to get to where he is, right? The difference between Mr. Olu Beckham and Chioma is that, you know, you can see the injury. You can see someone walk around limping around with a broken leg. You can't really see the mental, quote unquote, mental health injury. And so the same way we can't ask Mr. Olu Beckham or expect them to operate in the same way they normally function in. You know, I'm not gonna ask them, hey, can you walk to the store with me, or can you go do this for me? Because you can see their leg is broken. In the same manner, mental health, when our minds aren't operating in the most optimal way, we can't be expected to operate in the most optimal way. And it's all about getting back to your best self. It may take medications, it may take therapy, it may take both. It may require you to change a lot of your lifestyles or certain habits. It's going to take a lot of work, but there's that whole process that you need to do in order to get back to yourself. Any thoughts about that concept? Okay. Feel free again to put something in the chat, unmute, what have you. Now, I want to sort of delve a little bit into my story, all right? Probably like, okay, you're talking about who are you and why should we be listening to you, right? Like, what is your relevance here? I got you, don't worry. So I was born in Ghana, moved to DC, of course, hence the Black Stars. Moved to DC when I was 5. When I went on to University of Maryland, College Park, where I got my degree in biological sciences. And then I went on to VHU, Howard University, which is actually where PILS was founded. And so, you know, from Howard all the way to Nigeria and Africa, amazing. Anyway, so I graduated, and also shortly after Howard, I want to point out, and part of Howard is this wonderful organization, if you guys aren't already familiar with, called National Pharmacy Association, or NAPHA, and it's NAPHA. Very, very instrumental in where it allowed PILS to eventually grow. Not only the opportunities that they had for us to just grow professionally, but a lot of opportunities to meet some great minds, truly amazing minds, like your very own CEO, Dr. Joshua Blackwell, of course, George, and then Onye, through that organization. And it was an awesome platform and opportunity. Let's just talk about connection, for us to be able to form what this is now, what it looks like today, and build it from the basic infrastructure to this amazing, amazing product. And so just want to shout out that period of my life. Now, I do want to also highlight another period of my life that wasn't as bright. Between the time I went from Maryland to Howard, so during that time, we met a friend. I used to be in a band. Long story, uh, but we had a intern for us who did our photography, and she actually had bipolar disorder. She, you know, would always ask me questions. She knew I was going to pharmacy school. She said, "Hey, my doctor prescribed me these medications. Do I take them? Should I take them?" I mean, they give you you're the doctor. Like, I'm not a doctor. I'm not there yet. They're like, asking me these questions, and I give them the general answer as the doctor says, take this, you should take it. If it's prescribed for this condition, that's what would be appropriate to do. So I encouraged her in that. But she did kind of do a lot of wanting to pick my brain about what these medications do and so forth. Unfortunately, a few weeks after that conversation, she had a really bad manic episode and then a really bad depressive episode and overdosed and passed away. Now, for me, not to make this too grim, but for me, it was a mixed emotion of sadness and confusion, right? It's like, did I do enough to prevent this? Did I think the common response when grief happens or when there's a grief trigger, you start to blame yourself in some way or find a way to implicate yourself. So it was a mixture of that. I was able to kind of get over the fact that, hey, there's nothing that I can do or someone may have been able to do at that moment once that decision was made. But it is important to just recognize how the impact of such an experience, how it can be transformed into something beautiful, something beneficial to a large mass of people. Just even being from Ghana, being from Africa, I know that personally, in my experience, we didn't really talk about mental health as much. There wasn't really a big discussion about even your mood or how you're feeling. It's like, look, like I didn't have a lot of those discussions. And there's also the narrative that there's some level of spiritual warfare in mental health, and so it never really aligns as beautifully as it should or how we hope for it to be. I think that also prevented me from delving much into it. I do know a lot of people suffer in silence, and so with all these experiences, I felt that I had to kind of embrace that and form these passions into my profession. So I actually went ahead and moved from DC to Texas when I did my PGY1 residency program training, and I went on to do psychiatry. It's my second year. So I felt at that point, I'm able to sort of combine those experiences and feel a little bit more whole or kind of bridge that experience into where I am today and make something positive out of something that really did take a toll on me. I'm currently working at South Texas Veterans Healthcare System as a psychopharmacologist. In the outcare setting, I also am an adjunct pharmacy provider or professor at UT, doing more of the psych realm and the CPNP. Join CPNP if you at all remotely interested in psych or just in general. It's awesome organization. Then ACCP as well. All right, now time for you guys. I want to hear from you all. Well, you don't all have to talk. This is really honestly at your comfort level, but anything that you felt affected you significantly or shaped the way you operate in life as it relates to your mental health or just a mental health experience. It doesn't have to be necessarily about you. It could be about someone else or something you've seen, something you heard, anything. Just kind of want to hear some of those experiences.
So for myself, still being in school, when I first started pharmacy school, I hit kind of my first mental health roadblock, I would say, or well, maybe my first one that I was aware of, and I said, hey, something's not right. And I was going back into school. I had taken a gap year, and I wasn't performing the way that I expected or thought I should be performing. A lot of comparisons, all of the things, social media, am I falling behind the curve, etc. And I think what you mentioned as far as a lot of people suffering in silence, I had actually had a mentor, and I reached out to her and I said, hey, I can't do this. This is not for me. And she said, no, you can do this. I felt the exact same way. And that was eye-opening for me, because I didn't know that this person who looked a certain way, had a certain job description, someone that I had looked up to, had felt the same way, was in my shoes, more or less. I don't know what she meant by that. We didn't get into that, but she said, no, you can do this. You're not alone. I felt the same way. That's normal. And to a certain extent, and it kind of made me feel relieved. It was that whole suffering in silence thing. So that was my eye-opening experience.
That is amazing. I love that. I love that. And just for that openness, the vulnerability to share that space mentally and emotionally, it really does help to heal. And I think that's why I like the question like this. And can just feeling the comfortability to share certain things that may have been pivotal in your life. So thank you for sharing. Anyone else?
I see something in the chat. I see that Deborah, I think had an experience. Deborah, did you want to share, or you want me to read your comment? Rosalind.
Okay. Hi. Hello.
Hey.
Okay. I think I should say it. So, let's say I had a really tough time. Let's say so when I was in pharmacy school, I had a really long time where I was just feeling like I was underperforming, or I had a subsequent test when I felt like I read a lot, and when I just got into my exams, I blanked out. Like I really had some very low scores, and I could not just find it in me to just get out of that down spirit. I just felt so down, and I just felt like everyone expected so much of me, or I expected so much of myself. So I just kind of beat myself up throughout that year entirely. My grades really plunged, and I just carried that plunge from one semester to another semester. And let's say a week before my exams, I just stepped out for like a few minutes or so, and then there was a fire accident. So my room got burned. The whole of both my laptops, my script, both my reading materials, everything. So it was a really, really trying week. In fact, it was a really trying semester. In fact, a really trying whole year, because it was like I was just coming from one thing to another thing to another thing. During the first semester, I had an accident. I injured my leg. That was the first semester, and then that was including the old drama with my grades and all. And then the second semester, I had a fire accident, so that one too now downed me. But it was a really trying time. That was the year that I think I withdrew from a lot of people. I used to be a really lively, bubbly person, but it really took me a long time to just get back to the person. Maybe I'm not even entirely the person I was before, but to really speak to people more, I just drew into myself. I withdrew a lot. In fact, I had some really funny thoughts, some really, really interesting thoughts of some very violent things I could do to myself, because I just felt alone and just useless from the world. But I think that fire, after the fire, the fire accident was really big, so it got people's attention. So I just felt I had a lot of support for this. And again, like a week to my exams, it was a really trying time, but I think I got over it, at least. Yeah. So I think that time was a really big time for me, because I've had challenges before, but it was the first time after the fire. It was the first time I could see how helpful people can be. I got a lot of people wanting to talk to me. A lot of people. In fact, I didn't have anything. I was clothless, bookless, nothing. People made notes for me. People brought clothes for me, like several things. Just it was the first time I could see that actually community helps. You don't have to be so far away from people. I could always know that once I went to someone's room, somebody was just always there for me. Like that time was really, really tough, but I could really see that, wow, sometimes I just felt like just offering myself at a time. But I could just see that people were always there. Like, so, like, if you need something, you can just say, if you want to talk to someone, you can just open your mouth and just say, oh, this thing. And just know that somebody's always out there. You're not entirely alone like you think. So I think that was like a shifting point for me. So the fire was good and kind of bad, because the fire made people see me that I was struggling, but they didn't really know the extent of my struggles, except for the fact that they knew that I was propertyless. So I think, yes, like for like 2 years, it was a really tough 2 years, but I think I came out of it well. Yes.
That was powerful. Thank you for sharing. Honestly, I just want to reiterate how, you know, how much vulnerability it takes to do this, and your sharing of the story is very much appreciated. I'm sure that there are a lot of people who may have experienced some of those things, and so, like I mentioned earlier, not trying to suffer in silence, trying to be able to express these things. I do also want to point out something very important. With all this discussion about mental health, it's very, 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 very important to always seek professional help when you do feel down. If there's anything you take away from this is, um, you know, if you experience, or if you are experiencing, or have in the past, or feeling that way, please definitely seek out professional help, because it's tough. It's tough, and it takes lives, as we'll discuss in a bit. But thank you again for sharing. We can move forward just for the sake of time, but if there's anything else you guys want to share, please feel free to put it in the chat. Okay. So we've been talking about mental health. Okay. So how much of the burden are we talking here? Is this like, how serious is this thing? What is this mental health stuff, and who's even being affected? Don't worry. So there's a lot of different types that we talked about, right? There's the diagnosis of these conditions based off of Diagnostic and Statistical Manual, mental health disorders, that's also known as DSM-5. They'll define exactly what anxiety means, what is schizophrenia. And overall, we're seeing that this affects 15% of the population globally. And this number was actually before pandemic. So we're probably looking at upwards of 20, 25. If not more. And this is only people who are actually going and saying, I'm dealing with something. There's so many people that, like I mentioned, suffer in silence. We're talking about 970 million worldwide. Anxiety tends to be the most popular, and then you start to see depression as well. And then some of the substance use disorders, bipolar, schizophrenia, and then there's also a significant amount of eating disorders too globally. When we look at the map, we can see that a lot of these continents, they vary based off of various factors that one may kind of look into. Nonetheless, it's prevalent as in America as much as it's prevalent in Africa. There's many things that we see and go through. A lot of the parallels may not match, some do. However, mental health is a consistent and it's a constant. So regardless of where you are, it's not isolated to one location. And my homeland Ghana, and of course Nigeria as well. But just pointing out, it is very prevalent and it's present. So according to WHO, here are some of the breakdowns of mental health conditions and depressive disorders specifically, and I highlighted the US and Africa here. You see a significant amount in the Western Pacific region, as well as Southeast Asia. So just again, highlighting the concept of how this is actually a burden in the world. This is an interesting one. We're looking at global suicides by age and country and income level, and they break it down by gender. So it's interesting how in the lower income, females tend to die of suicide at a younger age, and then we're starting to see a creep up here for the males when we go into the older age, but in the higher income countries. So you can postulate what you think as to why this is the case, but yeah, I think it's just so many different ways to look at it. Nonetheless, we're talking about close to 800,000 people dying of suicide or more, and this is accounting for in 2015. So again, the number unfortunately continues to rise. It's considered the top 10 leading cause of death in the U.S. Like I mentioned, the suicide and even sharing the stories, those thoughts are very vicious. They come and without care, drop of a dime, it can happen, and it's very, very important to really pay attention to the processes and the breakdown as it gets there. So notable risk factors genetically, it's not just, oh, well, my environment is why I became this way. There's a lot of genetics that goes into it. A lot of studies that demonstrate brother has it, sister has it, mother has it, father has it. You have a high likelihood of experiencing that as well. And high, again, is relative. Percentages will vary based on the condition. But of course, your environment plays a huge role. Sorry about that. Life stressors, substances can alter, even turn on some of these genes. Some genes make you more likely to abuse certain substances, a higher predilection to substance abuse. Some conditions are actually co-associated. Then predisposing factors, and of course, medical conditions. There are medical conditions that put you at risk for certain mental health conditions. And then there's also medications that sort of propagate that as well. So many different factors. But again, the important thing here is being able to identify where the risk can be and try to mitigate that as much as possible. Of course, of depression, typically, and I want to kind of highlight depression here, is one of the top conditions. So for us, getting a grasp of when it shows up, usually in the late 20s, but this can occur after any acute life stressor. With treatment, we're talking about 20 weeks. Sometimes it's much longer, sometimes it's lifelong, and that's a completely okay situation or process. In the same way, if we talk about a broken leg, if someone has genetic conditions that make them more likely to break a leg, and there are several ones out there. So if that's the case, then they may have to permanently wear a brace or permanently put in certain measures. Same thing with depression. There may be situations, factors, genetic factors, or what have you, that may result in you benefiting the most from taking medications long term, and or even being in therapy for the rest of your life. That is very much feasible, and it should be understood and processed in that way. The problem with stopping treatment too early is a recurrence, which increases with every single episode you recover. And so if you recover, you go back, chances of it coming back increases. And of course, suicide, 20% lifetime risk. The ultimate, of course, outcome is almost like the heart attack for a person with coronary artery disease. This is our heart attack when it comes to mental health, suicide, and the death as a result of mental health conditions. But I like this message here. I have this in my office, my patients to see whenever they walk in. Suicide does not end the chances of life getting worse. Suicide eliminates the possibility of it ever getting better. It's almost like you're just transferring the pain to the next person. Again, we want to just emphasize that this is not something you just, it's not say, hey, don't commit suicide, it's a selfish act. It's not what that is. You wouldn't say that a person who has a heart attack after having a coronary artery disease is selfish for having a heart attack. No, it's a process of the disease. It's a process of the condition, and it gets to that point where it's uncontrollable, and unfortunately, that's the outcome. Here is just a mnemonic that is used to help remember the components of depression. We use that a lot clinically when we're interviewing our patients. Now, I don't want you all to get any ideas like this guy Mickey here and try to diagnose your friends. Don't take this and say, all right, you can't sleep, you're guilty all the time, you have depression. No, that's not what this is for. This is to help you recognize some things that you made, perhaps seeing yourself at some moments and seeing someone else and seeing, okay, well, I have noticed these patterns, right? We talked about Chioma Kardashian. She noticed those patterns, and then her friends called it out. Perhaps time to get checked out. So not for you to diagnose, just to kind of be aware of and know that it can occur. And now that doesn't also mean because you have these symptoms, you have major depressive disorder. It comes in various spectrums and shapes and sizes. And it's emotional sadness. Sadness is a regular emotional thing. You should be able to be sad. God gave you that ability to be sad and this processing of what you're receiving. angry, that's fine. It's all about when it gets to a point where it's interrupting your functioning, it's getting in the way of you being productive in the way that you hope to be productive, and significantly changes your dynamics of your relationships with others. That's when you may start to consider this is an actual condition I need to really get a hold of. Okay, so he's like, okay, but what's happening in the brain now? You know, like I hear all about this, but and I know there's a lot of mental health professions here, so, or rather health professions, so I can get a little bit nerdy. For those, if you don't know any term or anything like that, just feel free to stop me. But let's talk about it. What's actually happening? I love this part, the chemicals, because I think it's awesome talking about the chemicals because you hear a lot of conversations about, well, it's all in your head and, just think it away. Like, no, when you notice that there's actually chemicals at play, you'll recognize you can't just think these things away. Now, the three more important ones when we talk about the depression specifically and a lot of other conditions like anxiety and even PTSD, we often look at serotonin, norepinephrine, and dopamine. And we'll talk about the neuropath or the neurochemical pathway that people use to describe why depression happens in a second. But I just want to point out what they do and what their components are, their role. When we talk about just serotonin, that's where there's the obsession and compulsion along with memory. That's where you see that the defect in there usually is associated with serotonin. Someone who's obsessive compulsive, I know you've seen those OCD shows on Lifetime or whatever, those are all associated with serotonin. So when we talk about dopamine, this is more so pleasure, reward, motivation, your drive. You heard about the dopamine reward system. And if you think about dopamine, a lot of times think about chocolate. Chocolate helps release or helps to construct dopamine, and you feel happy, you feel pleasure. That's why they give chocolate, or they've advertised that during Valentine's Day. So that's dopamine. So when we look at norepinephrine, that's more so alertness, concentration, energy, right? Now, when you pair or you focus on two at the same time where they're working in synergy, you can see some variations like attention when you focus dopamine and norepinephrine. And for those farm folks out there, that's essentially bupropion or Wellbutrin. It's helping to increase these two chemicals, and that's what helps with your mood uplift, and also it helps with concentration. And we see appetite and sex controlled by both serotonin and dopamine, along with aggression. So sexual side effects and or sexual concerns related to your mood itself, it's a lot of times related to serotonin, right? So again, we're talking about treating depression, treating these conditions, and why we're even focused on these chemicals because of what they're doing. Anxiety, impulse, irritability, that's often associated with serotonin and norepinephrine. We also have to understand that you can get these from different diets. You get them from, healthy lifestyle, different exposures to different things, enough sleep, all those things you can help to promote the release of these chemicals. It's not just taking medication, but just highlighting the fact that these chemicals are there and they're playing a role, and that's where you see some changes in their mental health. I talked about the neurochemical pathway, and it's just saying that those are the chemicals that we talked about, dopamine, serotonin, and so forth. There needs to be enough in this space so that it can communicate to the next nerve. But when we're talking about depression and some of these conditions, there's just not enough. So the whole concept of helping to improve that is just increasing those chemicals. All right, I'll back off the nerdy stuff for now for a second. I want to pause. Is there any questions or comments? I went through all that kind of background of mental health pathophysiology. Any thoughts on that?
Hi, this is Star.
Hey.
Any foods you can avoid or recommend for like proper neurotransmitter release?
You read my mind. We'll get to that in a second. You saw this presentation.
Oh, good.
No, we'll get to it in a second. But good question. Great question.
I just had a comment concern as far as I'm learning the neurotransmitters, and it's kind of a new concept, right? I mean, I think it's not necessarily new that we knew as far as the chemicals and what they do, but as far as the stigma behind it and people actually quote acknowledging mental health, especially in the Black community here in Nashville, Tennessee, just in the US, I'm learning that this is a new concept and it's kind of hard for some to grasp, mainly the African American community. It's so hard. And so I just appreciate that you spoke on the actual neurotransmitters and chemicals in the brain and what those things do, because it's still more, I know spiritually, even dating back to, I think, like witchcraft, right? Mental health was not quote accepted or acknowledged. So I just want to appreciate that you spoke on that. And if you can comment on that just a little bit, is
Yeah.
it still a newer concept? Or newer, I don't know the right terminology to use, if you can help me out.
Yeah, no, a great comment and slash question and thoughts. Yeah, relatively, right? I think it's kind of the best way to put it. Relatively, when we think about just the progression of mental health in general, right? There's a lot of it, like you said, was really relegated to spiritual warfare or like witchcraft or just a person, quote unquote, going dumb, right? Going crazy or something happening, it just went crazy. So from the progression of the thought of what mental health is, uh, that perspective gives, yes, you're 100% correct in that neurotransmitter activity and what it represents is a relatively new concept. I think to your point, also the beautiful thing about where I am and where I'm positioned as a healthcare provider is being able to try to teach my patients and clients and your friends and family what mental health really looks like, right? Trying to put the tangibility to it, like the physical, why there's some level of, a manifestation of how you feel. Why is that? And that's where, delving into the chemicals and explain to you, dopamine does this. Eat a piece of chocolate, you're going to feel like this a little bit. And it's all likelihood of this happening. And so it's pretty cool to try to explain that and give that kind of connection to anyone who is wanting to know more about their mental health. That's why in the beginning I used the example of literally someone breaking their leg and the parallel of someone who's broke their mind or their mind is injured or is not operating optimally. It's bridging those gaps and hoping that we can move past it's just all in your head and really transition into how do we heal. But really, really good thoughts. Any other comments or thoughts? Okay, I'll move forward here. Right, so non-pharm therapies. We're talking about psychotherapy, self-care, ECT. I don't know if anyone's ever seen that or heard of that, but we're talking about rearranging the chemicals in your brain through quite a little quick induced seizure. Really interesting, but it's very effective. And usually this when we're talking about very severe cases. Excuse me. And we have a host of other special devices. Self-care. What is self-care? Let's talk about that. All right. So self-care, what can you do for yourself, right? What are some things that you can focus on? Because like we said, healing is dynamic. It is not just one process. It is a continuum of so many different things you can do and take and engage in. A lot of it is you. So we're talking about sleep. You want to get at least 7.5 hours of sleep, according to your age group. Sometimes there is too much sleep, and that could be a sign of also certain mental health conditions. But yeah, you want to get a healthy amount. Diet, what are you eating? What are you putting in your body? I'm huge on that. We were talking prior to everyone coming in earlier on. Speaking of Carson, actually, she was talking about the shameless plug, my mental health passion page and Your Mind, Our Business. And a lot of that, to Star's point, the diet, there's a lot of discussion on there where I talk about how certain food items that you eat can actually boost the chemicals in your brain. So it's important to incorporate that in a healthy way. Exercise, your health. There's actually studies that show that exercising increases blood flow to your brain, which then helps it to operate optimally. And studies that link increase in serotonergic activity, brain regions where serotonins are prominent, they tend to highlight during exercise. And so that's almost like a medicinal tool when we're talking about mental health. So exercising actually does help. And even in certain conditions, Exercising actually helps to release the endorphins, and also when we talk about endorphins, pain helps with the pain as well. So there's a physical and a mental piece that's being benefited. Exercise, y'all. Spirituality, of course. Can God and psychiatry exist? Of course. It's a component, it's a dimension of your cares. It helps to align you, your morals, your values. And when that is off, your mental health can be off, or vice versa. If your mental health is off, that can knock off your spirituality. So they're all very much connected, and religiously, and I'll just speak from a Christian standpoint. I know that in the Bible, there's a lot of discussion about mental health conditions and how, even Jesus dealt with anxiety and so forth. But just like any other health conditions, God wants you to embrace that. But most important thing is, regardless of what your spirituality is, it can be embraced within your mental health. Social support takes a community, friends, family, being in the right group of friends, the right environment. As Gen Z would say, you snatch my vibes, your energy's off, bro, whatever that you have to identify as an inappropriate, environment for your mental health. Make sure you're paying attention to it and correct it. Substance abuse, of course, there's regular indulgence, but when there's an overindulgence, when you really what I like to call maladaptive alcohol use or maladaptive substance use, when you're using it to help heal, using it in a negative way to cope with things, then you have a problem. But this is not a judgment to any kind of substance. Indulgence is fine socially and as a pastime, but the moment that you kind of have to ask yourself, am I using this to help heal something? That's where you need to kind of get that evaluated. Relaxation, stress relief, all that fun stuff. As Star mentioned, food. I love the incorporation of all these other things you can do outside of medications and even therapy to help boost your mental health, right? So we talked about those chemicals. Now you guys are experts on serotonin, dopamine, and norepinephrine. You guys know all about that, what they do, but these are some of the foods that can actually help to increase the production and or the release of some of these chemicals. So that egg, scrambled eggs, you're having at brunch, you're boosting your dopamine, serotonin. You might have some nuts and seeds. I don't think you're eating nuts and seeds at brunch. It's gross. But yes, if you happen to have that in your pocket or something, it's rich in serotonin. Dopamine, we talked about that. You see that oftentimes on Valentine's Day or days to help please your partner, make her feel good, happy. Chocolate actually helps with dopamine. So it's a trick. It's all a trick. They got your data. So we also have berries, reduces inflammation in the brain. And brain inflammation is actually very important when it comes to mental health. And that's why they actually have been looking at certain anti-inflammatory drugs that reduces the inflammation in your brain, because that actually causes a cascade of events which prevents the release of some of these chemicals. Also just causes a down production of just signaling. So inflammation is important to get control of, and there's various things to do for that. There's also omega-3 fatty acids. That's also been proven to be very, very helpful when it comes to your mental health. Now, of course, there's a lot of the ancient stuff, right? The stuff that, a lot of people like to say, the natural stuff, like stuff that's just natural, man. Like, I just want the natural, like the earth. I want to dig the ground up and find my medicine. You have to understand that, just like every other chemical or substance or product, everything has its good and its bad. That's the first thing I just want to say from the beginning. Everything has its role, everything has benefit, or some things have, or less benefit than harm, but it's important to recognize that regardless of what you're intaking, you have to know what it is. You have to know how it affects you. You have to know that it's not perfect. But it is important to know. I'm very much I like to look at things holistically, as I like to say. And I think the misnomer with holistic is that we think it's just, complementary naturalistic medicine. Holistic just means you're whole, right? That's really what it is. And so I love to explore a lot of these traditional medications, what they do. We try to do a lot of research on them and identify its potential role. Because I mean, we can all agree that there's a dearth of products that we have out there to really help with mental health. So expanding that as much as possible is very, very, for me, it's a passion and it's an interest of mine. So I really look into a lot of these things. Some I've tried for myself as well, but just wanted to highlight it for you guys. The very, very key thing, like I said, is don't just be very cognizant of your resource. Don't just take someone's random Instagram and decide to, hawk up on a whole bunch of rhodiola. Please talk to your doctor if you decide you want to try one of these items. I'll just point out a few things like St. John's wort, for example, very popularly discussed in the naturalistic world for depression. It has a lot of drug side effects for some of the very, very common agents that you may be prescribed, right? So if you don't talk to your doctor, I actually had a patient just last week. She came in for depression. I'm treating her with one of the SSRIs for depression. And I'm going through like what she's taking over the counter and all these things. She's like, I'm taking Uncle Ben's sleep soup or something like that. I'm like, what is that? And I pulled it up, and lo and behold, St. John's wort just sitting there as one of the ingredients. And I'm here prescribing her all sorts of stuff. She got all these anti-lipid meds and all the lisinopril, all this fun stuff going, and she's drinking Uncle Ben's sleep juice, which has St. John's wort. So be careful, y'all. Be very careful. But yeah, that's been touted. Albizia, I actually have tried this before. This is for anxiety. And I'm one of those that I like to actually try it, of course, if it's safe and appropriate, to see just the benefit outside of just the studies that I'm looking at. I'm risking my body for you guys. So Albizia, I have tried that, and it was supposed to help with anxiety and helps with sedation at night. Not just that, it's just not that effective. Even in the studies, it shows it's not that effective. Mucuna root, it's one that actually helps with not just depression and anxiety, but helps with sexual impotence and sexual dysfunction. So I have a few patients who actually take mucuna root with some of their antidepressants, which causes sexual dysfunction, and they're finding benefit for it, and it's not causing any concerns or harm and so forth. Now, I didn't prescribe it. They've spoken to their primary care doctor, and they said it's okay. So just pointing out that. Psilocybin, you've heard a lot about that. There's a lot of studies about psilocybin and different things coming out with it for depression specifically and PTSD. There are a bunch of other things. I'm sure you've probably seen Kava Kava a lot because of some of the liver concerns. So again, pointing out that not everything's perfect just because you found it in the ground. Lemon balm, I've tried that actually. That helps with anxiety. They're studying a lot of that for dementia now. And we know a lot about ginkgo. And we know, of course, I could call on any one of my ANCARE friends and they hear ginkgo and ginkgo and it's like, bleeding disorders and all those, we used to call it the gangster G's when I was in school. But yes, side effects, interactions. Lion's mane, I've had that. I had a lot of dementia. Do I have dementia? No, I don't know what's going on, but I had a lot of these. But this actually is tasty. It's this mushroom thing. So that rhodiola and ashwagandha, I have their tea. I've tried that. That's supposed to help with anxiety. Is really anxiety that is touted for. One thing I want to point out is very important about rhodiola and ashwagandha is that if you have immune conditions, you want to make sure you're careful about that. A lot of the studies that I came across talking about those, there were some negative effects associated with those with autoimmune conditions. So just to highlight, amongst other things, we still just don't know about these agents. So all in all, just be sure again to talk to your provider. Be sure to not trust any source that you see, especially on Instagram. Just vet it. Not saying that it's not true. It's just that you just have to vet it, right? And just don't hoard on these things, please. Just don't hoard these things and start trying to treat yourself. This is not what this is. All right. So thank you. Okay. Now I want to hear from you. I've been talking too much. What are some things you do for self-care of your mental well-being? Let me know. What do you do? You've seen a lot of different things I talked about, but I want to hear from you guys. What do you do for yourself, for your own mental well-being?
Hi, this is Star. What I do is I really lean into my support system. My husband's probably like my best support system, and also my parents. I'm happy that I have a very calm, like mannered husband. So a lot of things into perspective, and it's really great when you have someone in your life who has like who is a more who shows you a different perspective, and also it's great when you have someone who validates who validates your feelings about things, but who also gives you like their own perspective in a way that doesn't belittle yours. Right. So my husband has a lot of emotional intelligence, and so that helps me to like talk things out. He's a great listener, so having someone in your like corner who can like listen to you when you're having a bad day, but who can also like provide like a different perspective, and who just makes you feel like validated is great. And then also I try exercise. Nice. I need to do better at that. I need to try having a better diet, because here's the thing, and it's been said before, if your mental health is off, everything else is off. Specifically in my life, if my mental health is messed up, I know I'm going to eat like crap. I know I'm not going to exercise, because your mental health gives you the strength and energy to do other things. Yep. And so I definitely believe like journaling is great. Therapy is 100% top tier. Like those are things like, I think journaling and therapy is like amazing. And here's the thing, if like none of the non-pharmacologic stuff works for you, then it's okay. And then just, if you need medication or you feel like you want a second opinion, not being afraid to go to your doctor and be like, hey, I feel like I've done all the non-pharmacologic things. I feel like I journal. I feel like I have a good support system. I feel like I do all these things, and I still feel how I feel. And we're just realizing it's okay to not be okay. Right. Just because we're in healthcare, I will speak for myself. I felt like I had to be okay because I'm in healthcare. How can I not be okay when I'm telling my patients to be okay? Exactly. Like, yeah. So definitely just realizing it's okay to not be okay. It's okay to ask for help. It's okay to really like lean in, because sometimes people think that like asking for help or seeking support is a sign of weakness. No, it's a sign of strength to be able to say, I'm not okay, but I want some help. And I think, I'm willing to ask for it. Yep. Absolutely. I love that. And I love that phrase. It's okay to not be okay. That is awesome. Again, thank you so much for sharing, Star. All really, really good things that you're doing to incorporate into your overall well-being for your mental health. Anyone else? Anything that you're doing in particular?
Okay, let me say something. Okay, so personally for me, at that point, you personally don't know what to do. At the same time, you feel like, I feel like, okay, I need to speak to someone, and at the same time I feel like I don't want to speak to that person, or I just don't want to talk about it. So personally what I do is, okay, I take some time off and just lock myself up in the room. Yeah, I lock myself up in the room, try to think about it, and sometimes I even get tired of thinking about it, so I just try to sleep, try to play music, try to find things that would take my attention away from whatever is troubling me at that period of time. And then when I feel okay, I just try to take a stroll, walk around, just to feel the weather, the breeze, and just see people around me. and I try to streamline what I watch online. Of course, you can see some things online that would even get you more pissed. I try to streamline what I see online. I try to, at the time when I want to speak to someone, I try to select the kind of people I talk to, people that I know that would help me.
Yeah, absolutely. You know what you said, Roslyn, was very important. Thank you for sharing. There actually is a lot of studies that indicate watching comedy helps to increase serotonin production and serotonin messaging. So yeah, sometimes it is watching certain things, and actually looking at old pictures of memorable events in your life also helps to boost serotonin transmission. So these little things that we take for granted or we don't recognize. When someone says, okay, your friend says, let's go watch a comedy, or let's go, visit hometown, or let's just do this little seemingly meaningless action, it actually is doing so much for you. One thing I also want to point out is that the tough thing about mental health is the condition itself prevents you from doing the things that will actually help you heal, right? So when you're dealing with depression, you don't want to move, you don't want to, it feels heavy, you don't want to do anything, but it takes doing something. It's actually the act of those other things is what helps to heal the condition. So it's very, very difficult when you're talking about trying to heal on your own or doing it by yourself. That's why it does take a community. It takes people around you to be willing to help, support and push forward. So great thoughts so far. Anything else? Any quick things?
Yes, this is Star again, because you actually said something that made me think. When you are going through anxious moments or depressive moments, because for some it may not be diagnosed anxiety or diagnosed depression, so I'll use episodes in this case. Sometimes the things when we're going through those episodes are not beneficial. So for example, if you just lay on your couch and just watch Netflix all weekend, it's you don't have the mental capacity to do anything else, but it's not helping you. So then with that being said, not exercising, you don't have the mental capacity to get up and do things. Or for example, if you spend the whole day on social media, just scrolling, it's giving you boosts of dopamine and things like that, but it's not social media. I won't say, I haven't done much research on it. I know for myself, I get my little bursts of dopamine from scrolling all day, but I don't feel better, because then it's I'm comparing myself to someone who's on a month-long European vacation. Meanwhile, I'm stuck at work, and I'm on day 9 out of 10. And so I don't feel better, but yet it gave me my burst of dopamine that I was looking for. So could you speak on things that we do that quote unquote feel better for us when we're going through those episodes, but they're not actually helping us?
Yeah, that is such an excellent point, Star. I love that thought and that thought process and just the question. Yes. So the big thing that, just to kind of clarify everything that she mentioned, the thing here is this: you're gonna have moments where you feel like this sort of numbing action is helping you heal, or you don't recognize that you're dealing with something as you're going through this kind of repetitive action, right? So when we think about depression, one of the biggest signs is anhedonia, or low desire to do things you normally enjoy doing, or just low motivation, right? And so you may not move, right, but you're watching this countless hours on Netflix or just scrolling through your phone. The problem with that is there is always some level of temporary stimulation, right? The dopamine hit that Star mentioned, whether you get a like or you see something pleasant on Instagram, you do get a release. But what happens is the difference is a very short release, is a very short feedback loop, right? It's just saying quick release, and there's a drastic response that causes a high demand or high desire for another release, right? Now, if it's just doing this and looping here, does it have an opportunity to stay in the cleft, or the other areas that it needs to go to really heal what you're dealing with, right? It doesn't. that's a problem, just looping around that same little area because the way it was released was quick and not sustained. So it's stuck in that area and not really propagating and really helping to target these other areas of your brain that is necessary. That concept is why when we look at substances as a coping mechanism, especially with alcohol, for example, it's kind of nerded up again. We're talking about the GABA receptors in your brain that the alcohol hits. And once it hits that receptor, it releases a whole bunch of other chemicals, but it slows down the brain processing. Although it does also hit the dopamine reward system. And so you get that little quick sort of turnaround. So not only are you slowing down your brain's processing, right, slowing everyone else down, you're also causing this kind of quick distracted dopamine that's just looping around. And so you're never really healing. You get a fake, like, oh, I'm happy for the moment, and you'll need more and more and more to keep that quote unquote happiness up or that numbing up. And then after a while, you're talking about, you're dependent on it to kind of keep sustaining. But that's the dangers of using anything as kind of a quick high or a quick burst. Does that make sense? Any thoughts on that?
Yes.
Awesome. Thank you for that question. All right, so let's proceed here. I want to make sure we have enough time to go through a few of these things. Okay, we talked about the non-pharm, fun stuff, great discussion. Now, pharmacologically, what does that look like, right? Well, since a lot of us are already in the pharmacy realm, or at least in the medical realm, I'm gonna more so do this as a true or false, right? And these misconceptions, understand that it's not just the patients or the non-health individuals who have these misconceptions. A lot of providers themselves actually have these, and it is not to point fingers or it's not to demean anyone if the thought process was this. It's more so to highlight certain gaps in the knowledge that we have of these agents and really how they're supposed to work. So, with some of the main misconceptions that I hear whenever I'm seeing a patient or just kind of in general is that psychiatric medications are addictive, right? The reality is most of the common medications used to treat the mental conditions that we often talk about, the things that we're really, really concerned about, from depression to schizophrenia, all those, anything, anxiety, most of those do not have an addictive profile, or they're not ones that you get a physiological and a psychological dependent on them, right? And really scientifically, it's the degree in which it targets that reward system and also a function of how you process things that help you, right? If you process things that help you as your savior, then you have a high likelihood of a psychological dependence. But that means other things needs to be addressed. But nonetheless, the medications themselves in general, they don't have the addictive properties, and it is a very common misconception. Another one is my medications should kick in right away. And a lot of you all probably already know, when we talk about antidepressants, for example, they take about 4 to 6 weeks of taking it daily, all right, to see the full benefits. So other medications like antipsychotics, they can have it much sooner, certain anti-anxiety meds much sooner. But all in all, we're talking about, a long time of being consistent with it to see that change. And the reason why that happens is because in general, whenever you take something that is adjusting the way your chemicals are releasing, your body's going to try to balance things, but recognizing that, you're resetting your new balance. And that takes time. It takes about a month and a half. So, if you ever encounter patients with antidepressants, or if you know anyone that's taking it, or even you yourself, it's always important to remind that it takes time for you to see that effect. And so it's not like, this doesn't work, I'm done, throwing it away. But you gotta be patient. They do not work. That is another one. I got this a lot actually from my colleagues in other professions, even some in pharmacy, but some other professions like physicians who just simply did not want to prescribe it, or sort of disregarded it, like saying it does not work. They're not perfect, right? But there's been a lot of studies that demonstrate psychiatric medications having a positive effect for mental health conditions. And it's actually pretty similar to a lot of these commonly prescribed agents, right? Overall, the efficacy is around 50 to 60%. And the more you experience these episodes, the more you relapse, the harder it is to treat. Just like any other condition, like say, for example, cancer, the more relapses you get, the more likelihood or the harder it is to treat. So, okay, well, what do you mean it's effective? Like, and relative to who, to what? Well, these are a lot of common agents we see, right, prescribed. You've heard of several PPIs like Prilosec, right? Of course, metformin. Everyone gets metformin. As soon as your A1C ticks up, metformin for everyone. All that. ACE inhibitors, statins, aspirin. Well, look, antidepressants, despite how commonly recommended ACE inhibitors and statins are, they actually have shown a higher effect size. So it's just indicating, it's not saying one is better than the other. And of course, there's so many different factors, but it's important to recognize, yes, they actually do have a benefit. And we've discussed the chemicals that it's affecting and how it has an effect on your mental health. So just wanted to ensure that that is clear, like there's some effect. And it's not perfect, but there's some effect. The other one I get a lot is going to destroy my liver and kidneys. I'm done. Like, no, the reality is a lot of those rarely cause direct damage. However, it's important to talk to your doctor and look at your own personal health to see, is it safe to take this particular medication, right? Again, nothing is perfect. And this is just only one dimension of treatment. But yeah, the concept that automatically if I'm taking it every day is going to destroy my liver and kidneys is false. Oh yeah, then you get I saw someone on Google say their left arm exploded when they took Prozac. I don't know about this one, doc. Like, the reality is not everyone responds the same, right? We know that there are factors that can include their genetics. What were they taking with it? What were they even taking it? Are they just trolling? What other side effects were there? All those things shapes the outcome. So it's never good to just go off of someone else's experience. Although genetically, there is an opportunity to see what may work based off genetics, your family. But when we're talking about going on Google and seeing someone put a random report, you want to be careful because everyone's experience is different. I won't have control of myself when I take them, or I'll be a zombie. It's a very common one. The reality of it is the meds are intended to help fix the conditions mentally that's thrown you off from being closer to who you are normally. So it's helping for you to better function. So a lot of actually when I'm following up with my patients, I'm checking to see how well they're functioning versus are you happy, right? That is such an arbitrary term and concept. It's not are you happy, it's how well are you functioning? How much are you better able to process and handle the stress that is inevitably going to happen in your day-to-day? So the reality is you're going to have a lot of patients who are in the midst of the triggers that is causing their mental health to decline. And so it comes to a point where medications, we're trying to help you just at least function through it and hopefully the situation resolves. So it's just important that it doesn't change who you are at the core. Now, if you are experiencing kind of a zoned out experience, then it's not working. It's the wrong one for you. And you have to consider perhaps a different agent. Just very important to consider that. Now, what stops us from seeking mental health care include, hey, will I seem weak? Will I be called crazy? I don't want to be called crazy. And the weakness thing also kind of co-associated with that, thinking that mental health decompensation means you're weak. No, think about again our guy Odell Beckham when he broke his leg. He's not weak because his leg is broken. It's an injury. And so it's not weakness to recognize that something's not going right. And I think it actually demonstrates strength to actually pursue something that's not going right so you can be the best version of you. Will I lose my job? And this is a very important one too. There is, I think, historically a lot of co-association of if I have a mental health condition, that means I can't get a job or I shouldn't report it, or I can't even take this medication because it shows up in my urine and all these things. I think it's an important question. And I don't think I can unanimously or just uniformly say that every job does not discriminate against mental health conditions, but it is important to note that it's as it becomes more and more normalized, being transparent with your your supervisor or your job where necessary. Not saying, hey, going around, yeah, I'm done with this, so don't talk to me. I'm not saying that. It's more so saying if it comes up, then having at least the comfort to be able to describe that. And there are, of course, a lot of discriminatory laws out there that I encourage everyone to pursue if you are ever in a situation where your mental health is impacting your job and is being discriminated upon. I see Carson raised her hand. I'll let her speak.
Yeah, I just wanted to share here again in Nashville, Tennessee, my class, the class of 2024, we actually spoke to our class advisor, and we now have like a clause for mental health days in school. So it's similar to employment, right? Because that's our employment right now, school. But we were actually able to rally up and advocate for ourselves that this doesn't necessarily count as a quote absent, an excused absence, but it won't count against you negatively. So no, there's a lot of times where it's negative thoughts, but sometimes there's positive outcomes. So I just want to share that and encourage anyone to, rally up some troops or whatever it may be, even if it's yourself being a lone soldier, because we actually had a really positive result. And so now we have mental health days.
That's amazing. I love that. I love that. Thank you, man. Thank you for sharing. Anyone else?
Piggybacking off. Oh, sorry.
Okay, go ahead.
Oh, piggybacking off of that, I really want to know. So I work for a government entity. I work for Indian Health Service. I have so much. I have like well over like 200 hours of like sick leave that I have not used. And I really want to take mental health days. And I have no idea how to like legally ask for them, especially when your administration is like, we're short staffed. And we have no staff. Basically, even if you have 1 hour appointments, they're like, well, who's supposed to cover you?
Right.
And it's hard in that sense.
Right.
For one, because I would love to ask for mental health days. I have students. I'm a preceptor. I have students who are like, I'm taking a mental health day, and I'm just like, that must be nice.
Gen Zers, man.
It's like, that must be amazing. But when you ask the question, what stops us from seeking mental health care, it took me a very long time to get a therapist because I have traditional baby boomer parents who are just like, well, you can just talk to me. Like, you call me every day. I'm basically your therapist. No, you're not a mental health professional who can help me unpack my life and all like the things that I like question. And so a lot of times I've had people like, oh, I don't need a therapist. I have my parents, I have my spouse, I have my this, but who am I supposed to talk to about my parents and my spouse when they're stressing me out? Like, I can't talk to them about them. So like I say all that to say is like, I feel like my religion, like Christianity and things like that, first stopped me from seeking out mental health care. Because take all your problems to God. I am a firm believer in taking all of your issues to God, but I also believe that God created therapists. So I guess I say all that, like, the stigma from even your loved ones can stop. That stopped me for a very long time until I had to, as I learned from therapy, to set boundaries with my family, telling them how I absolutely need a therapist. So it's definitely like, it's hard for me to really like address like mental health on more so. I've done it personally. I haven't done it professionally because I would just love to walk up in my chief's office and be like, I need a mental health day for like the next like week. But I'm not going to do that. So how would you suggest like working for, like, since you also work for a government entity, requesting mental health days?
Yeah, it's, well, see, the interesting thing for me is I'm requesting it through my supervisor who's also in psych. So they're like, yeah, of course, like almost soliciting it. Like, who needs a mental health day? So for me, I would say I'm an outlier in that sense. But, I think this concept here, it's going to take, it's a multifactorial sort of approach to get to the best answer or the best setup or situation for being able to do that. It takes a lot of cultural shift. And as we're, again, I think we've been doing it more, especially after the pandemic, of understanding what mental health is and the concept, like the way that I kind of described it today, and Carson sort of pointed out, like putting tangibility to mental health, being able to help normalize that society, which I think, as we know, influences legislation and influences change, whether a person likes it or not. It may influence change in their department or their facility, which allows and even calls for mental health days and mental health breaks, so that when it's requested is normalized. I think from that piece, and then also just from self, in this infant stage that we are when it comes to mental health days, from yourself, it's being confident in, knowing yourself, knowing what you're dealing with, and being confident in choosing yourself and choosing to take care of yourself. That allows you to advocate for your mental health as much as you would advocate for your physical health. So that, I think, is where, for us, that's our role in this dynamic. And I do think that is solved by having these discussions, talking about it, of course, seeking professional care, which further justifies why you may need to take some time. And it doesn't mean that just because you're seeking care or with a therapist that you're automatically dealing with a serious mental illness that incapacitates you. It's not what that means. Is you have someone that is accountable for your mental health, and that's it. So I hope that kind of answers it. But that is the kind of the way I look at it. So kind of moving forward, I know we're very short on time, almost done here. But just a few other questions that pop up, believing how, as we kind of talked about, I can just suck it up. We know very well that this is not feasible. You can't tell a person with a broken leg to just walk it off. The same way you can't tell someone who's dealing with a mental health injury to just suck it up. So yeah, and of course I can just pray it away. Understand that prayer is a very much important part of who you are, and it's not just pray it away. It's pray and do therapy, pray and take care of yourself, pray and make lifestyle changes. That is really the way to look at it. I'll quickly kind of go through these, but the research here just wanted to point out how it is often the Black and African American population, minorities that tend to either avoid treatment or don't have the same access to treatment. And also the stigma that plays a role in the social circles, especially amongst men, feel like it's weak, and then, and women also feel like they're being too emotional, especially in Black women. We often hear that, unfortunately, where their expression of emotions or the any sort of expression in that vein is considered a stereotype of, oh, you're just being an angry Black woman. That is a very unfortunate cultural or just societal issue that prevents just even that cohort from being able to really express themselves the way they need to. So it's very important to help dispel these barriers. And we can kind of go through this really quickly, but just if there's any quick ones, what is your biggest barrier to not addressing your mental health? And if anything, just something to think about. What do you feel like are barriers for you and for you to not address your mental health? And shared a few that is very, very good, very, very common. But something to think about. And if you have anything, feel free to share that as well as I'm going through. Oh, sorry, go ahead.
Okay.
Go ahead.
This might not be for me, but I'm just going to be talking generally as a Black Nigerian. So for Nigerians, I've come to realize that most times people don't get to talk about it because, Nigeria, well, I won't say just Nigerians. Let me just say Africans are spiritual. Let me put it that way. And then once you complain or once you try to talk to someone about it, they just assume, oh, it's a spiritual problem. Let's take it to church, and they start praying about it without, going through the right process. And then when you, as a medical practitioner, are trying to, explain to them, okay, this is not just spiritual stuff, it's real stuff happening to this person, they tend to look at you like you're crazy. And they tend to feel like this person is crazy. And that's why most times people don't get to talk about it, because they don't want people to see them as crazy. Exactly. And they don't want, they need help, but, the kind of help they are getting from people is not the kind of help they need. So this makes people, it's more like a barrier for them now. They don't want to talk about it because they know that they're not going to get the kind of help they should get. And I think that's what medical practitioners are trying to curb away right now in Nigeria. For instance, and when you talk about Nigeria, trying to make people realize what mental health is all about, and trying to educate people more about it, because I feel that if they know what it is about, they would give more relevance or more time to put their effort into it, to always attack it the right way it's supposed to be attacked.
Yeah, very key. You hit the nail on the head, and what you just started out that conversation with, or that statement with, was the spiritual aspect, right? Is being able to have that incorporated, helping to dispel what even we've conditioned ourselves in a spiritual space to think, and combining it. And that's literally the concept of what I like to call, just perfect harmony and peace, right? Physical well-being, mental well-being, spiritual well-being. It's having all three in harmony, and being able to understand that they all coexist, paying attention to them equally, and knowing that is a very key component of you feeling like yourself. So that leads me to the final three gems here. Mental health requires you to want you to be better. This is about you wanting to do this. This is about you doing it for yourself. You can be motivated by other people, like your family, your friends, doing it for your kids, doing it for your wife, doing it for your husband, doing it for the people who you look up to, or they look up to you. It's important to have that motivation. However, you have to want it for yourself, and that's what sustains mental health. It involves your community. It's not just you. We saw in the beginning various examples and so many discussion points that you all have said. It's always, there's some level of association with someone being there or supporting you or showing you, the beauty of what a connection is, which is what we're doing here, connection. And mental health should be a constant dimension of your well-being. You saw that the triangle figure: your physical health, your spiritual health, your mental health. Now, this is more so for you to think about, if anyone wants to quickly share, but really just think about, what is one thing you'll do today to positively impact your mental health, right? I just want you to at least walk away with that. Like, I'm gonna try to purposely prioritize it and ensure that I'm doing at least one thing every day. You feel like you need to exercise every day or eat right every day. You also have to think about, what are you doing for your mental health every day? So feel free to put in the chat. I know we're short on time, but I'll leave you with that thought. Also, just again, shameless plug, but this is, for me, all of this that I talked about, and Carson also, again, had a great discussion in the beginning, where it's like, she ran to my page where I talk about mental health. It's like, it's exactly sort of what I describe as my passion page, right? It's the concept of minding your business that we often say, well, your mind is my business. And it's the ability to kind of express and learn and grow in the mental health space. So check it out if you can, or if you want to just have that continued discussion on mental health. And of course, make sure you're following PilsConnect if you aren't already on the social platforms. And then, of course, Innovent, make sure you're following them as well. But I want to say thank you very much, everyone, for this opportunity. It was awesome. I enjoyed it. I had a lot of fun. Just starting my day in such a powerful and important way. So thank you all for having me on this stage, and just sending love and joy and peace to everyone. Thank you. Take it away, Chandler.
Awesome. Can everyone join me in giving a virtual round of applause for Dr. Sackey? Let's give it up for him. Let's give it up. That was truly empowering. It was very impactful for me, and I'm sure it was for everyone that was on the call today. So thank you so much, Dr. Sackey. We really genuinely appreciate you and what you're doing. Once again, your mind is our business, and I love it. So without further ado, thank you all for being here today. please take the gems that Dr. Sackey did present to you today and do something impactful today and for the rest of your days as we continue to go on with Gym. Wanted to give a quick announcement that we will be resuming Gym in January 2023. To help with self-care, we're going to make sure that we allow you all to focus on your families and your well-being in November and December. So holidays, being able to really focus in on those things that mean a lot. And it will resume in January, where we'll be discussing professional and personal branding by Dr. Sydney and Neba. So that's going to be a great one, Saturday, January 28th, 2023. Make sure that you also please follow us on all social media platforms, complete the post-connection survey to evaluate how you felt about this presentation so we can continue to collect this data and make sure that we're keeping these metrics as high as possible. But we all know that this was impactful for you. So please let us know how we did so we can continue to improve going forward. Once again, I know I'm sorry, Chinello, but we just wanted to make sure you got your time for November, December, and get back in January. See a lot of comments in the chat for Dr. Sackey. So thank you again, Dr. Sackey. We really appreciate you. But other than that, I'm gonna let you all have a great rest of your Saturday. We've been amazing to have you for the first 3 Saturdays, and we're looking forward towards more Saturdays and more gems to come. So everyone have a great one. Thank you at every stage.